This is Dr. Daniel Paull, orthopedic doc with Easy Orthopedics, and today we're going to talk about getting through the healthcare system without having any medical insurance. If you like this video, we put out new content weekly, so please like and subscribe. So health insurance, I have a lot of thoughts on this. So I don't take any health insurances, Medicare, Medicaid, any United Healthcare, I don't take anything. But I think it ruins medicine. But also I don't have any health insurances. So I don't carry it for myself and my family. Now part of you is saying, oh my gosh, he's a doctor. What do you mean you don't have health insurance? So let me tell you what I do. There's two things I do. One is I pay cash for small things, right? I pay cash for a direct primary care doctor. I try to pay cash for my medications. And then that works as long as you don't have any serious chronic medical diseases. The second thing is that I use a health share. The one I use is Sedera, S-E-D-E-R-A. It's non-denominational, and I've actually used that for like the birth of a child or a surgery that I had on myself, and it sort of works like health insurance, except that you're functionally uninsured to the hospitals and you have to negotiate everything and pay cash and float bills. But to me, that's a little bit better than health insurance if you're healthy or your family's healthy, because you can go, there's no networks, you can go wherever you want, but you do have to do more work up front. But no, I don't carry classical health insurance. I think it's mostly a scam. So anyways, those are the two things that I purchased for myself, my family, is a direct primary care membership and then a health share. So I have some, in the direct primary care, I can go in as many times as I want. My family can go in as many times as I want. I pay a monthly fee. It's different from concierge medicine. It's not quite as expensive because concierge also bills your insurance. So those tend to be like really high, just more expensive than your direct primary care. And that takes care of most of the issues. And then I use the health share if anything sort of catastrophic happens. But if you're navigating the healthcare system, if you have a lot of chronic medical issues or are on some very expensive medications, this probably will not work that well for you. In that case, you probably do need to get health insurance, whether it's Medicaid, whether it's Medicare, or whether you have to get on the Obamacare. And that's probably going to cost you a fair amount of money unless you can get on sort of a state-sponsored plan or get health insurance through your work. So then I would say it does make sense to probably get health insurance because of the cost that you're incurring. But if you're generally healthy, I would just do what I do. DPC combined with a health share. So the DPC takes care of most stuff, and then anything you can't use out of that and you have to go in system, then you can use your health share. And that's what I do, and I think that's what sort of works the best. Calling standard practices and trying to get cash pay, you can request a good faith estimate, but it's non-binding and there's no penalty for violating it. So the health service doesn't necessarily have to stick to that, and you can still get billed. So I essentially try to avoid going into the healthcare system whenever possible, because you can't control the billing, and that's when you get bills, and it's just nothing makes any sense. So I try to stick as much as I can with cash pay providers, and whether that's for surgery or anything else. If I have to go in, I just I use my health share and try to make the best of it. But that's what I do. That's what I'd recommend. If you're healthy and your family's healthy, it's a much better combination, DPC and health share, than just get going on the exchange and getting an insurance. If you do have a lot of health issues, then probably getting standard health insurance is unfortunately your best option at this point. So I hope I was able to answer your questions about how to navigate the healthcare system if maybe you don't have insurance. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only. Thanks for watching.